Okay, welcome everybody to the Weiner Wellness Virtual Summit. Back with us yet again, making his third appearance. Is this the third time, Mike?
Third time's a charm.
That's right. Today we're going to talk about pain, go away, natural solutions to inflammation and pain. This is Mike Gallagher, outside sales rep for Nutritional Frontiers and incredible field educator. He was my rep in Pittsburgh. He is available to any practitioners that are watching this in Pittsburgh or Ohio. So please welcome Mike Gallagher, and I'm going to pull up your PowerPoint, Mike, so you can get started.
All right. Thank you, Dr. Tracy. Appreciate the kind words. As always, just have to bring you along with me everywhere I go.
Better than a business card, huh?
Absolutely. Absolutely. Okay. So as Dr. Tracy alluded to, this presentation is all about pain, and there's all different types of pain. Very simply, we can define it as acute pain, so sharp pain on a scale of 10, 10 being just unbelievable pain. We're talking like 5 or higher. And then we have more chronic pain, the nagging hips, knees, and so forth, and shoulders and so forth. So we're going to break it down. The good news is we have a lot of options, and you can't go wrong with really any of these options, but we'll show you how we position them. And we'll show you where I've seen to get the best clinical results. So I just want to make a disclaimer. We're not treating anything. We're just making suggestions here. Never ever get off your medications. You always want to work with your PCP. But as you know, the goal, if you are trying any of these things, working with them and you feel better, hopefully they can reduce those medications, which is the goal, right? And we'll talk about some side effects from even over-the-counter medications today that most people might not be aware of how dangerous they really can be. Okay, so let's begin. So just a little background. First of all, this is a great example of what happens with arthritis. So on the right-hand side is, damaged you have the normal cartilage, and then you have the damaged cartilage, right? So that eating away that tissue, the erosion, and this can happen with many, many different factors, obviously wear and tear, obviously injury, again, food absolutely can play a role. Genetics can play a role. I mean, so there's many, many different factors involved, but the whole idea is trying to rebuild that damaged cartilage. Now, a classic saying that I hear a lot, especially from orthopedics and doctors, is bone on bone. And, I always, Dr. Weiner taught me a long time ago, how you can tell if a person has bone on bone? Okay. They would be in bed. They would be bedridden. They would not actually be able to walk, let alone stand. So just because the orthopedic or doctor may not see the cartilage on the x-ray, or it's very, very limited amount, doesn't mean you don't have any. And so what I've seen through the years and what Dr. Weiner taught me and working with so many other practitioners is that we absolutely can rebuild this cartilage. It just takes time. You didn't get arthritis overnight. You got to give us a couple months to rebuild it. But if you take the right formula, the right dosage, we can and give it enough time, we can actually rebuild. So I just want to emphasize that with everybody out there. And when we go through this presentation, again, this might not specifically pertain to you, but I would bet money that you have a family member, or a friend or neighbor that has some of these issues. Okay, so please share this and pass this on with them. Okay. All right, so a little background, inflammation. What does that really mean? So it's a Latin word there, to literally set on fire. So this whole cascade of events, as I mentioned, can be injury or trauma related, and that can be broken down: physical, chemical, biochemistry, biological, and again, acutely or chronic. So the changes here occur on many levels. So your tissues, your cells, your blood vessels, all are inflamed. But what people have to realize that this is part of the healing process. And I know it's uncomfortable. No one wants to be in pain. Again, I get it. But it is part of the process to heal and repair. And unlike the medications, which are blocking this pain and inflammation, we are actually getting to the root of the issue. We're actually trying to repair it and heal it. Okay, so there's a big difference. We'll talk about that as we go. Of course, all the classic signs and symptoms of redness, heat, swelling, of course, pain. It can be all these, it can be one of these again, but really, when you look at all chronic health conditions are inflammation, okay? Every single one of them. It's just on what degree and what level is this inflammation occurring. Okay, next slide. So the major players are in your white blood cells, okay? They are known as your cytokines, leukotrienes, and prostaglandins, okay? These are the markers that drug companies test for, and these are the same markers that we have studies with our nutrients and supplements and formulas that actually have been shown to help, all right? So again, this is the classic example of this would be is take a sprained ankle where leakage of fluid into those tissues, you get bruising, you get swelling, you get the pain, right? So that is a classic case, but it can be a lot of other things also as well. Okay, next slide. So again, all the classic symptoms, we just went over that. But on the second bullet point, I think, again, is what we're trying to emphasize. There's other types of inflammatory issues, and these are classified in the allopathic model as autoimmune diseases, right? So classic example, rheumatoid arthritis, okay? But it can be colitis, irritable bowel, blood pressure, asthma, you name it, right? So, but rheumatoid arthritis it classifies autoimmune because your body's attacking itself. So what I have learned and been trained on in Dr. Weiner and many, many different other practitioners through the years is that autoimmune usually is a leaky gut issue, right? Yes, you have pain, and this is the hardest part for people to realize. You have pain typically everywhere else but your stomach, but the source is actually your stomach. So if we can help you on the pain side with some of the formulas on the acute pain side, but also help you out with your leaky gut, with your stomach, such as our GI Complete and probiotics like superbiotics, and then we avoid the food triggers, what is causing this, we can dramatically help with even rheumatoid arthritis and other autoimmune issues. So again, we're not making any claims here, but like I said, I've had numerous cases through the years where we can dramatically help. So that's another type of inflammation. But again, we just want to point it out. Okay, next slide. All right, so the conventional approach to treating inflammation are drugs, and guess what? More drugs. Of course, you do the rest and the exercise and physical therapy, and those all play a role, and definitely we recommend that. But medications are not typically getting to the root of the problem or healing or repairing. They are blocking the pain and inflammation. They temporary are Band-Aid, but they're not fixing the problem, okay? So we start, typically the approach is the nonsteroidals, aspirin, ibuprofen, Advil, Aleve, naproxen, okay? If that doesn't work, then you go to more specific, higher things, more aggressive things such as corticosteroids like prednisone, which that has numerous side effects as well. And then we get into more hardcore stuff like methotrexate, which is technically classified as a cancer drug. It is a cancer drug. I can't tell you how many people I've talked to through the years at Dr. Weiner Wellness Center who are on methotrexate. I ask them if they are aware that that's a cancer drug, and most of them are not. So again, these are not the best situations, shall we say, or best approaches, shall we say. Okay. Now, how dangerous are they? Right? So you can always look at the warning insert, right? If you can read it, if they're written so small these days. But you can also Google any medication and look at the side effects, and usually there's many. But we did a little statistical analysis here for you, okay? So this is looking at NSAIDs related death, okay? NSAIDs related death related to other death or disease issues, okay? So this is not Mike Gallagher saying it. This is not Nutritional Frontiers. This is goes back to all the way back to 1998, okay, where the American Journal of Medicine wrote a study, published article on this, how many people are dying, okay? And then a year later, right after that, New England Journal of Medicine said the exact same thing, okay? So there's over 16,500 deaths that are occurring from people who are taking their prescription NSAID at normal dose per year. Again, let's highlight that again, because that's really important. 16,500 deaths a year from taking your prescribed NSAID at normal dose. So this is not overdoses or anything like this. Now, to put that in proper context, when you compare that to how many people die of AIDS worldwide, it's the same amount. Now, everybody recognizes that AIDS is a worldwide, serious situation, right? And then you look at leukemia, 20,000 deaths worldwide, right? And then you keep going down the list there and you see, but those NSAIDs, that is just United States, okay? US prescribed that died, okay, which is frightening. So what we have on this as well, if Dr. Tracy, if you could go to our website, and I just want people to, if they need to, show this article to any family member themselves, but if they go to our website, so are we able to jump out of this PowerPoint?
Yep. 1 second.
Okay.
We'll jump around here a little bit.
So we have what's called consumer health alerts. Okay, we have many different ones on all different types of topics, ranging from blood pressure to cholesterol. All right, but we have at the top end, you see all these alerts. You can just click on the alert side, and you see we did one on vitamin D the other day. But there's the alert tab, so you just click on that right on our website. And then you go down the list here and you see all different ones. But the one that we are talking about today is the over-the-counter pain meds. Okay, over-the-counter pain meds. So if we click on that. Okay, so here it is, all right? Here's the actual articles. Anybody can look this up, all right? And this is even more detailed. So back in 1998, right, American Journal of Medicine said not only were there 16,500 NSAID-related deaths, but 107,000 patients hospitalized yearly, okay? Yearly. Now, if you keep going down the list here, if you scroll down a little bit more, right? So a year later, New England Journal of Medicine, so these are two of the most peer-reviewed medical journals out there. So in a year later, in June 99, New England Journal of Medicine said the same thing, but look at what they said, that first sentence. It is estimated conservatively, okay, conservatively, that, right, that these related deaths are occurring every single year, right? And if you keep going down, if the deaths from GI toxic effects, this would have been the 15, were tabulated separately, the effects would constitute the 15th most common cause of death in the US, right? They do not even include deaths for over-the-counter. So they can't even track over-the-counter NSAIDs. This is just prescription. So these numbers are way, way low, right? So anybody can jump on this. Anybody can look at this. You can share this. but anybody who's on any of these type of medications, again, consistently, so again, Advil, Motrin, Aleve, naproxen, even aspirin. Okay. These are not wonder drugs. These are not magic pills. These are definitely not to be taken every single day. So we have a lot of options. We're going to get into those here in a moment with the rest of the PowerPoint. But the other thing is, how long should you take these medications consecutively? Well, if you actually look on the insert, it says do not take for more than 3 days. It does say that right on the insert of these medications. Do not take for more than 3 days. So ideally, never would be the answer. But if you do have to resort to these medications, folks, only 3 days. Do not take them for more than 3 days. And unfortunately, we know people take them for years and years, and they wonder why they have so many other health problems. Okay, because it causes a disruption in the rest of your system, especially GI bleeding, especially liver. The other thing about this, you don't see about this anywhere in the mainstream media. Never do you see these kind of articles written or publicized or talked about. But so we have to do a lot of digging to find these, but they're out there if you look long and hard enough. The other thing is that athletes have a problem with this. So a couple years ago, maybe 5-10 years ago, two famous basketball players, Alonzo Mourning, and there was another one that they both had to retire from basketball because they were getting liver damage from taking their NSAIDs every day. So this is a big problem in the athletic world as well, not to mention the geriatric community and so forth. So the point with all this is these are not the best approaches. These literally can kill you, right? So we're not joking when we say that. There's legitimate reasons to avoid these if at all possible. These are last resorts, not first resorts. Okay, so Tracy, if we could go back to the PowerPoint. All right, folks, so we talked, next slide. All right, so what are some of the natural options? So this is our Cadillac. This is our number one supplement that we would recommend for pain and inflammation, X-Flame. It's one of our flagship formulas. It's one of our most unique formulas. There's no other supplement on the market that has all the different ingredients that we're using in here. And it's exactly what it says. We're trying to reduce or not need those pain meds. It will help with pain and swelling. It will help with mobility if you take the right amount and you give it a long enough period of time. Okay. So what's in it. So this is the recipe, folks. So some of these you might recognize, such as turmeric and boswellia and ginger and quercetin. Again, these are have been used for centuries. But the thing that really makes this unique are the first two ingredients, creselazine and DMG. Okay, so together, this combination, the synergy that all these ingredients are working together is faster than just taking turmeric by itself, for example. So that's our approach on all of our formulas, but this is a classic example of that. So let's talk about these ingredients a little bit more in detail. Okay, so next slide. Okay, so creselazine. Most people have never heard of this ingredient because it's a newcomer to the nutritional industry. It was actually introduced into the nutritional industry in 2008. So I work with many different types of practitioners, and I've never met one that heard about this ingredient and knew anything about it. So this is really, again, we're always trying to get you the best, we're always trying to get you cutting edge ingredients, and this is unlike any other. So creselazine basically is a fatty acid, omega fat, okay, combined with a creatine complex, okay? So it's a combination of those two together that produce this very unique ingredient. And it has a US patent on it to reduce inflammation, increase flexibility, and modulate pain. So folks, let's just stop for a second and then let's really understand what that statement is really saying. A US patent So first of all, to have a U.S. patent on an individual ingredient on a nutritional supplement is extremely rare. There has tons of research that has to take place. It costs millions of dollars of research and studies to get a U.S. patent. And then we now can make a claim, right? So typically all other supplements have that warning label, may not prevent, treat, or cure disease, okay? Only drugs can have that label. However, creselazine, we can make that statement. It can actually do what it says. It's making a health claim. So this is extremely, extremely unique in the supplemental and nutritional world. And there again, as I said, there's tons of research behind this. We'll share with one case study as well here in a second. In fact, let's go to that next slide. Okay, so when we were looking at this ingredient, we saw this study, and this study just blew us away. So this was a double-blind placebo-controlled study, again, the gold standard. And what they were doing with the creselazine, there's this individual ingredient by itself. They were comparing it to their over-the-counter medication, okay? And after 30 days, they did a comparison, right? And they just simply asked them how it rated every person in this control group. How did it rank or compare to what you currently were already using and for all these different ailments? So look at the results here in this study. 100% of people said it was just as good, if not better, for ankle and foot pain. 80% it was just as good, if not better, for your other extremities, neck, shoulder, elbow, wrist, and hand pain. And 71% said it was just as good, if not better, for knee pain. Now, folks, so you average it out, that's pretty darn good. So what we did then is we had a unique experience is working with Dr. Weiner's clinic. Of course, Dr. Weiner, one of the co-founders of Nutritional Frontiers, because we're like, is this study too good to be true? Because, some of these things you see, they seem too good. And so we actually did our own in-house pilot trial at Dr. Weiner's clinic with just this one ingredient, creselazine, and a much larger sample pool. I believe 144 people were involved who were already on a medication, who wanted to try it. And we got exactly the same results as this study. And that was really the big aha moment. And that's when we decided we need to introduce this. And so that is the story behind it. And this is also very unique as far as our company, Nutritional Frontiers. We actually are trying these ingredients and these formulas already in-house, so to speak, before we break it out to a national level. So it is, it's been tested, it's been tried and true before we even came out with it. So just a little background about it, but that's a really amazing study right there. Okay, next slide. These are just some of the testimonies. I mean, we have hundreds of other ones. Again, this first one felt better than any other drug I've used, had arthritis and swelling in the knees. The second one had shoulder pain, did something what the meds couldn't do, actually had mobility and improved my quality of life. And the last one, of course, helped with back and knee pain. Worked so well, I did not even notice the pain after 3 to 4 days. And that's how long it usually does take. I mean, there are cases where I have seen it work in 1 day, but realistically, depending on your pain, it does take a couple days. So again, it's not blocking the pain like a drug. It works on a different level. So we just want to emphasize this. But these are the kind of results and testimonials that we've heard over and over with this. Okay. Next slide. So that was just the first ingredient, folks. And then we add all these other ingredients, DMG. So I did a talk on this on Monday. So if you want to go back and watch that, I could talk for hours on this. I won't today, I promise. But DMG had a U.S. patent on it for treatment and inflammation as well, and treating all inflammatory disease. Now, these patents ran out, so we can't make those claims anymore, but that's still, we can just still use it in the past tense. And the other unique thing about DMG is it's a methylazer. It's your master methylazer. It will help with the absorption of all these other ingredients as well. So Again, the first two ingredients are what really separate cresellazine and DMG in the X-Flame, and they both have or had patents to treat pain and inflammation, folks. I can't make it any clearer. There's no other supplement that I've seen in 26 years that actually can say this. This is the only one. So please keep that in mind. Okay, what else there? Next slide. Okay, so the X-Flame. We have it in two versions. We have it in a powder. We have it in a capsule. They're both exactly the same ingredients, right? Some people for powders, we get it. Some people for capsules. But here's the key with this is taking enough of it. So if you're working with kinesiologists like Jeff Nisnik there at the clinic, which I strongly recommend, he can actually test you to see if this tests strongly for you, which most cases it does, and also how much do you need. But generally speaking, what I've seen is that people need to do a temporary loading dose if you're in pain. So again, what would that be? If you're doing the capsules, 4 capsules for breakfast, for lunch, and for dinner. So 12 a day. Or if you do 6 breakfast, 6 dinner. But I do recommend it with food, okay? 12 a day until you feel 100% better, okay? And again, for some, that's, could be 1 day. For some, could be a few days. But once you feel better, then we back it down to 4 capsules a day, right? So initially 12, temporarily, that's the key, and then 4, right? Now, if you go with the powder option, 1 scoop equals 4 caps. So again, if we're doing that, if you're in a lot of pain, acute pain, we would recommend 3 scoops a day, 1 breakfast, 1 lunch, 1 dinner, until you feel better. Then you bring it down to 1 scoop, okay? It's as simple as that. Now, as far as contraindications, again, we would recommend this with prescription blood thinners, especially if you're not getting tested. And folks, again, please consult your PCP if you are starting any type of nutritional program as well, okay? Now, for faster results, we have other formulas, right? Who doesn't want faster, quicker results? We all do. And so we have fish oil, and then we have HA+. Now, HA+ will actually really help on the back end as far as rebuilding that cartilage. Okay, so the X-Flame for any inflammation for the acute pain situation works the best. I've also seen it great for headaches and migraines as well. I've also seen it work with asthma and upper respiratory issues, because some of these ingredients that we're using in here also have research to help with lungs. So there are, and again, asthma is an inflammatory issue. So there are multiple benefits to this. Again, I just always like to take 1 or 2 a day, just to, again, keep that inflammation down. Okay. All right. Next slide. Now, say you are a strict vegetarian, or say you have a more stress-related pain, or like fibromyalgia, for example, or say 12 capsules is too much for you. Well, we do have another option, and that is Inflame 2. So Inflame 2, we've had great success as well. Instead of 12 a day, we would actually recommend 6 a day is where I've seen the best clinical results. But you look at the different ingredients, it doesn't have the DMG, it doesn't have the cresellazine, it doesn't have those patented ingredients, but it does have herbal. So all herbals, that holy basil, that first ingredient, is excellent for stress-related pain, like I said, as well. But the second ingredient, that curcumin, is very, very unique. So we'll talk about that more in a second. So either one of these two are excellent choices. It really comes down to what you prefer, okay? So here's that curcumin. So this is a patented trademark form of turmeric, okay? So curcumin is the extract. And so what they found is that we figured out there's new technology called ultrasol, that it's basically a molecular distillation process that shrinks the molecule size of the curcumin to make it much, much more absorbable than regular curcumin or turmeric on the market. Okay. In fact, the research shows that it's up to 46% more, 46 times more absorbable than regular curcumin. Okay. And that's one point. So you can't patent turmeric or curcumin because it's an herb, but you can patent the process. Okay. So that's one unique point. The other thing that's also that most people do not know is that all the other studies that were done on curcumin and turmeric were all done in India. And that population already eats a tremendous amount of turmeric in their diet. So the question really is, how much more do you need to supplement with curcumin for people who eat that type of diet, Indian diet, if you already have enough in your food supply? And the answer is you don't need that much. And the supplement companies know this. So this is very misleading and deceptive, shall we say. We feel these studies are slanted. They're not our world. They're not our reality. Like the Indian culture eat on a typical everyday diet. So where's curcumin? So this curcumin studies were done in the United States, all right? Our population, our typical diets, very little turmeric in our diets. So we feel that the studies are even greater than 46 times because they're actually done with our population and our real world diet. So just want to give you a little background, folks. You will never hear that from anywhere else, I guarantee you, because everybody else is playing the Indian turmeric game. All right. So again, some real behind the scenes for you. All right. And we do sell, by the way, we do sell the turmeric just by itself. Tracy, if you want to just show people that as an example now, because we have changed that. So we go back to our website. Okay, so Turmeric Plus is the name of it. Actually, so Turmeric Plus, Tracy, not the tincture. Okay. So it's not on there, folks. So I'll just tell people so we can, but you can go to the turmeric, or you can go to the inflammation tincture since you're on there.
Yeah, I'll find it. Just give me a second. You know how ours searches, right? We'll just
Right.
We'll go to catalog it. We'll find it through inflammation. There we go. It'll be here somewhere. Boop. Let me know if you see it and I miss it.
I haven't seen it.
I guess it's not on there. I don't know.
Yeah. Okay. So we'll get with our graphic designer and we'll get that up there. So I just want to let you know it is available, Turmeric Plus. We did switch over to the that curcumin trademarked ingredient. It's twice as absorbable, at least, than the regular one. So the old formula was 120. The new one is 60, but you only need to take 1 a day versus 2 a day of the old formula. So again, just want to keep that in mind for people to be aware of. With that, or again, you can do loading doses with that if you prefer that one as well. But then we have this tincture. This tincture is very unique. So if we click on that for one, or look at the text sheet, the ingredients there. So the tincture is for people who prefer liquids, right? But people who prefer herbals. And again, it has a lot of the same herbs that we've already covered: boswellia, cat's claw, yucca, devil's claw, turmeric, right? There also should be another one on here as well. We need to update this too. So we need to update both of those. We will too. But this is just another option. If you prefer the tincture option, we have that as well. Okay. All right. So now that is on the pain side. Let's go to the rebuild side. Well, there's the Turmeric Plus. So we do have a slide on it. So there's the new bottle. That's what it looks like. The new curcumin is in there now, folks. So again, Excellent version of Just Straight. Fish oil. Okay, so if we want to jump on the website on that one, Tracy. Okay. Yep, there we go. Okay, folks. So I did want to let everybody know that we are in the process of rebranding our line. So we are going to be removing the Roman numerals out of a lot of our formulas. There are two exceptions to this. Well, nothing's changed with the formulas, okay? But there are two exceptions. We're still going to keep Live Clear and Live Clear 2. And the fish oil, we're going to, when we transition from omega-3D2 to omega-3D, we're now using the triglyceride form. So TG stands for triglycerides. So you'll see that after the total omega-3 fatty acids as TG. So the strength has not changed. The EPA, DHA, the vitamin D, nothing's changed there whatsoever. This is still one of the strongest, most potent omega-3s on the market. But TG is a more natural form. Is if we were to eat fish, that is the form it comes in. So this is the good triglycerides that actually help if you have high triglycerides in your blood. This would absolutely help. In fact, it would be my number one supplement. If somebody had that blood work, I would recommend taking omega-3s, but you got to take enough of it. Okay, so fish oil absolutely will help with pain, as well as brain, heart, eyes, skin, hair, hormone, and immune system, and 500 other things. Okay, so again, you can never go wrong with fish oil. The key is taking enough of it. So ours is the EPA DHA per pill. So that's broken into serving sizes, 2 soft gels. So per pill, it's around over 800 milligrams, along with the vitamin D. And so what they've shown, the research is that for pain, you need at least 2,000 milligrams a day of fish oil. The problem is the most abundant source of food that has the highest amount of omega-3s is wild salmon, and it only contains on average between 300 and 400 milligrams. So nobody out there is consuming, 7 servings of a wild salmon every day. It's impossible. And by the way, it takes 3 months to get into your cellular level here. So it's impossible. So you need to supplement. So 2 grams, 2,000 milligrams is little over 3 soft gels. 3 soft gels gets us to that 2 gram mark. I typically go 4 soft gels. If you are in pain, that's closer to 3 grams or 3,000 milligrams. So that is going to give you even faster results, right? So 3 or 4, if you are eating fish that day, wild fish, maybe just 3, but if you're not, I would go 4. So that's the key with omegas. You got to take enough for it to really make a difference, and you got to give it enough time, 3 months, to get into the cellular level. Now, if we scroll down, we do have a liquid option. So the liquid is over 2,000 milligrams. Just 1 teaspoon is over 2,000 milligrams. And again, if you don't have any issues, just half a teaspoon. But this is actually lemon flavored. To me, it tastes like lemon olive oil. There's very little, if any, fish taste. I know a lot of people have this negative image of cod liver oil back in the 90s or 80s. That's not what this is. This is super clean, folks. And again, if you prefer liquids, this is a great option, great for kids. Again, just half a teaspoon. You can also put this in any liquids, protein shakes. You can also put this on salad dressing as well. So there's a lot of ways we can get your good fats in there. But again, helps on so many different levels. You're not getting enough. And one of the amazing things that it can do is help with pain. Okay, next slide. All right, so we are certified by the International Fish Oil Standards Program. That's really the only certification program on fish oil. And then we get it independently tested as well. We have these lab tests on our website. Anybody can look at this. This is also very unique in the industry. So again, feel rest assured, we've done our due diligence to avoid all the mercury, all the contaminants, PCBs, and so forth that so many fish oil on the market have. Ours does not. Okay, super clean. Okay, now with the time remaining, we'll just talk about the rebuilding side. Okay, so up until now, we're helping with reduce that pain, reduce that inflammation, but now it's all about the rebuilding. Let's rebuild that cartilage. And our number one formula for this is HA plus. So arthritis issues, osteoarthritis, knees, hips, back, neck, shoulders, elbows, wrists, fingers, feet, you name it, any extremity issue, any joint issue that's troubling you. So the unique thing about this is, and again, this is actually our original formula, okay? Yeah, we've had this since day one, HA plus. So this has never changed. It's, again, one of our flagship formulas. They're at Weiner's Clinic. They do exceptionally well. They sell thousands of bottles a month or a year of this, rather. Because it works, folks. It works if you take it properly and you give enough time for it to rebuild. So it has a very unique form of hyaluronic acid called collagen type 2 by BioCell. We'll talk about that in more detail. It has some additional extras, glucosamine and MSM. There's also chondroitin, which makes up that collagen as well. And also, by the way, it's excellent for the skin. There's research on this as well that will actually reduce fine lines and wrinkles. 12-week study, taking 4 caps a day. So it's not just good for your joints, it's excellent for your skin. Okay, so let's continue. Okay, so this really does a couple things. The first 2 weeks that it does is it actually helps replenish what's called the synovial fluid, the layer of fluid between your bones and your joints. So this has a lubricating effect, right? It reduces that wear and tear, and that's what's happening is this layer of fluid is rubbing against your bone and causing this pain, inflammation. So typically within the first couple of weeks, the HA plus will start doing this. Okay, so you're going to get that immediate, that help on that level. And then the second aspect of is the rebuild. Okay, once we rebuild, then it will help with range of motion and flexibility. That second portion is what takes time. That typically 1 to 3 months, depending on the severity of your pain, how long you've had it, what your diet like, a lot of factors involved, right? So you got to give it a couple months for it to get to this point. Okay, next slide. Right, so BioCell collagen is what this is. And this is the most researched, most absorbable form of hyaluronic acid on the market, okay? There's numerous patents on this, so we can make structure function claims as well with this as well. So we just talked about the uniqueness of patents. So again, helps with the joints, helps with the skin, as I mentioned, as well, and can also help with hair and nails. So that's pretty amazing formula, because it can help with numerous different benefits, not just your joints. Okay. Next slide. They've compared BioCell to all other types of hyaluronic acid. And again, it blows it away. It blows it away as far as absorption, as far as how much you need to take, all different types of testing. Okay. Next slide. All right. Compared to glucosamine, sulfate. So when you look at glucosamine, we're comparing it to the other forms. Sulfate is the best form, all right? Hydrochloric acid is not the best form. Again, a lot of companies cut corners here. They use the HCl. We're using the sulfate form. So again, just keep that in mind. Next slide. Okay, so as I said before, the HA lubricates, then also acts as a cushion for the bones. Most people don't know that. And it also removes waste products from the joint capsule, so it has detoxification properties too as well. So again, some very unique characteristics. Next slide. Okay, so this was one of the groundbreaking studies done with BioCell for the hyaluronic acid we're using. Double-blind clinical study, okay, showed significant peak absorption and being able to stay bioavailable state as well. Next slide. All right. So it got into the bloodstream within 4 hours and it peaked in 12 hours. Okay. And so, again, you can't patent hyaluronic acid, but you can patent the process. So, similar to what we talked about with curcumin, we're also now doing with hyaluronic acid. So, what they've been able to figure out a way is to shrink the molecule size 600 times smaller, and therefore it's much more absorbable than any other hyaluronic acid on the market. And that's what they patented, this process. Okay, that's the uniqueness. So 28 days, steady state. It needs to be, though, consistent every single day, right? As well, to get it stay in your bloodstream. Okay. Numerous safety studies, again, excellent, generally recognized as safe, totally no issues whatsoever. Just a slide on the absorption state. For time, we'll just scroll through this. Again, studies again showing the peak bioavailability. Again, pretty much what we told it earlier. Again, also helps to maintain those hyaluronic acid levels, and that's an inflammatory marker we're inhibiting there, so it helps on that. Again, Womack scoring system. Okay, so this is again a questionnaire, showed significant change versus placebo. Okay, where there were no changes at all. This is one of the studies on the wrinkles. So again, showed within 28 days, all right, showed it got into system, increased bioavailability. And now again, the studies were 12 weeks, but again, it takes about 28 days to stay in your system. All right, so the HA is again on the joint side and cartilage side. The green lipid muscle is more for tendons and ligaments. So think shoulders, strains, and sprains. So this is very, very unique. If you have a condition that has both those problems going on, then I would recommend both HA and green lipid. But if there are things like sprained ankle, again, is a classic example, or shoulders, shoulders are very difficult to heal properly. This is fantastic. I have numerous case studies of this helping with so many different cases. So green lipid would be our number one for those kind of issues. Next slide. CBD, can't forget about CBD, hemp extract oil, absolutely can help with pain. And we have a very unique transdermal cream. All other CBD creams on the market are topical. So we're using a compound called lipoderm. So and lipoderm has only been used in the hormone compounding world to push hormones deeper into the tissue. We're doing the same technology, but with CBD. So we hear so many times it lasts longer and there's no smell to our transdermal cream. And they do have this at Wine Wellness Center. So again, excellent for pain. And we'll know minutes, literally 15 minutes or less. If you're in pain, I've seen this time and time again. Just had a case where one of the staff had pain and she did this, and with 6 minutes, it was gone. So it's pretty remarkable with CBD. Another great option for you, as long as you're not getting drug tests. We don't recommend you take this. If you are getting tested, there's a chance it will not pass. So that's really the one big issue with CBD. Okay. With all of our formulas, everything is guaranteed 100%. They're all in FDA certified facilities, guaranteeing 100% in what's in the bottle to end of expiration date. Numerous audits. Again, so the highest purity you can get using some of the best technology out there, and the best ingredients make for just incredible formulas. It's going to really try to jumpstart your situation. Last thing here is relax. If you have more spasms or muscle cramping, muscle tightness, for females, PMS cramping, this is fantastic. So this works on a different level. It's a natural muscle relaxer. Typically, we recommend 4 capsules at once if you have these issues going on. And again, we see results very quickly, usually minutes, if so we'll know very quickly if this works. But again, great results for these type of issues. So there it is. Again, for time, folks, we're just going to go through this, everything I just said, any type of muscle tightness. If you have those issues at nighttime, by the way, you would just take it right before bed. We also have fantastic brochure, inflammation solution brochure. So a lot of the formulas we talked about already on the left-hand side, but the food choices, that's the big thing on this. These are all anti-inflammatory foods. So your diet does play a huge deal with pain and inflammation. As I said, if you keep eating the same foods that are triggering the inflammation, there's no supplement in the world that will actually help. So the food, you combine that with the supplements, absolutely, that's a great winning combination. So general guideline for you. And again, folks, they can help you with this more in detail at the Weiner Wellness Center. Okay. So the easiest, I didn't say, but real quick, the easiest comparison, we always like the analogy we like to say, Dr. Tracy, is we can't rebuild the house if the house is on fire, right? So the inflamed, the turmeric plus, all the inflamed tincture, CBD cream, all those put out that fire, and then the HA plus or green lipid can rebuild the house, right?
Excellent. Well, I love the part about the cytokine storm. I don't think people really understand that the immune system gets busy when you have systemic inflammation from an injury, leaving you susceptible to other things. And if you're dealing with chronic pain, chronic inflammation from an injury or past injury, that it really does matter and does affect your immune system. So doing something like this to take care of the injury, whether it's chronic back pain or whatever that looks like, can actually help you prevent other diseases or conditions, especially in a time such as this where everyone's so afraid, right? It's going to do nothing but help by taking care of yourself and utilizing these products. So that was probably the most poignant slide for me, where I was like, oh yeah, okay. Yeah, I was like, now I can see why people that have, chronic pain or inflammation tend to get sick a lot.
Yes. And I know the amount of people who die. I mean, you had talking about that the other day with Dr. Hunneman, and the toxicity, adverse reactions, with this one, with the pain meds, it literally could kill you. And most people are not aware of the damage that it can really cause long term.
Right. Effects on the brain. Yeah, that was a really powerful discussion and makes people realize that, this is really acute trauma care. It's not chronic disease management. That is not what it was ever designed for. Allopathic, it wasn't designed for that. It was designed like, if you are acutely hurt, traumatized, or your arm falls off, we're here for you. But if you want to live a long, healthy, quality life, you're going to have to learn how to live it. And there's no pill that's going to accentuate your lifestyle. There's just not one. So anyway, great information. So if you guys want any of these products, please call the Weiner Wellness Center, 412-922-WELL, WELL, or you can visit their website at drweiner.com. Mike, thanks for your information. And everybody stay tuned. Charlene Bollinger is up next from Truth About Cancer. And we are going to be talking about the Truth About Vaccines 2020, which is coming out October 13th. And what does the new coronavirus vaccine look like? So, all right. Easy topic next. Yeah. See you later. Thanks, Mike.
All right. Have a great day. Be well.
Bye.
Bye.